Well, Dr. Rhonda Randall, I heard you had this wonderful title as Chief Medical Officer. Let me see if I can remember. Chief Medical Officer of UnitedHealthcare, employer and individual. So I'm so excited you're here to talk to my audience, which is made up of people born between 1946 and 1964, and you know they call them baby boomers.
Indeed.
All right, you got any help for the baby boomers as we try to navigate the rising cost of healthcare?
Yeah, absolutely. As a geriatrician, Valder, I love to talk to you and your audience about ways to stay healthier and avoid unnecessary costs.
Okay, so how do we do this navigation? Because the rules of the game change almost every day.
Yeah, and it's really going to depend on what kind of plan you are. So I've got a little bit of information today for people who may still be getting their coverage through an employer-sponsored plan, and we can also talk a little bit about those who are on Medicare. But transparency to what healthcare is going to cost is becoming more and more important. People want a shopping experience so that you understand what your out-of-pocket costs are going to be before you get your care rather than after and you're getting that big bill. So United Healthcare has cost estimators in our app and on our website where you can find and price care. In addition to that, more and more employers are starting to offer modernized health plans. So United Healthcare, we offer a plan called Surest. And with the Surest health plan, and this is for people who get their coverage through an employer, it's eliminating your deductibles and it's showing you your care options up front in that shopping experience on an app or online. And it's displaying the information about the providers where you can get your care and what your copay will be based on the provider that you choose. And by doing this, people who have Surest are saving 50% on other out-of-pocket costs compared to traditional health plans.
That's exciting information. Beyond these medical visits that we have, are there additional benefits that we should be taking advantage of?
Yeah, your health plan might offer rewards and incentives for making healthy choices. So, whether it is a United Healthcare rewards program where you can get rewards for completing some of those things like taking a certain amount of steps a day, tracking your sleep, getting that annual checkup, for example, or United Healthcare's Care Cash, which is offered to eligible members by some employers, where we're actually loading dollars on a prepaid debit card. Then you can use those dollars for your healthcare expenses, so you can earn that money by making healthy choices and sharing that information of that activity that's completed, and then having dollars put on that card for things like your copays and preventative care and other healthcare expenses.
Okay, tell me the importance of preventative care when it comes to saving money, because you're saving your own life.
Absolutely not. Yeah, not only are you saving your own life, which is the most important thing, but it's probably obvious to all of us that if you catch something early, it's a lot easier to treat. And when it's easier to treat, right, that's less disruption for you and your family. And it's also good for your financial health because your out-of-pocket costs are likely to be lower there as well. So this is a good time as a family doctor and a geriatrician that I remind people, if you don't have that relationship with a primary care physician, if you haven't had that wellness exam for a while, this is a good time to make a phone call and establish that relationship.
Okay, Dr. Randall, my audience is spread out over multiple platforms. I'm going to take this one from Facebook. It says that America seems to be so far behind other countries. They say that they're a heavily traveled tourist, and we're not where the other countries are. Why? And how do we get there?
So no two healthcare systems are designed alike, whether it's in the United States or another nation. And each of those healthcare systems has its strength, and each of those healthcare systems has its opportunities to improve. But a couple things that we know are true. Number one, our lifestyles matter, right? So those things that we do, like getting a good amount of activity and making healthy choices around what we're eating, are important. The next is those things around prevention. So think about things also like dental, vision, and hearing benefits. If you haven't had that dental checkup and that dental cleaning for a while, now's the time to look at what your dental benefits are and think about making those appointments. Cancer screenings, immunizations, and those other things that we get checked for at those annual visits. Blood pressure, cholesterol, more and more understanding about mental health and how the mind-body connection is important. Our primary care physicians are trained to do that. So establishing that relationship with them has a very wide benefit to your health.
Dr. Randall, thank you for such an elegant response to the poster. There you go. If they want more information, they want to really get healthy, where do we go?
UHC.com is our website, and on UHC.com you can get more information about resources and some additional tips.
Dr. Randall, you are a treasure, as they told me when you came on. I really appreciate you for stopping by the Valder Beebe Show.
Thank you, Valder. Be well.
Hi, I'm Valder Beebe, host of the Valder Beebe Show. We have over 1,000 videos on ValderBeebeShow.com and YouTube.com/ValderBeebeShow. We upload new videos daily. Our site is a modern baby boomer platform with news and information important to boomers. Subscribe to YouTube.com/ValderBeebeShow and stay connected as I interview the world's most fascinating people.